To you by Health Diagnostic Laboratory, Inc.
Welcome back to the broadcast. Well, it's Tuesday, and we are back with our friends from the Health Diagnostic Laboratory talking about disease prevention. Boomer and Dr. Dahl, hello.
Hello.
Love when you guys are here. It's always like an educational moment for everyone. So we're talking about prevention, and really that's like the basis of this entire business, is helping people take control of their health and prevention, right?
That's right. That's right. One of the things that I talk about when I talk to doctors is I say I have a little saying called prevention is the best cure, which in actuality it's true. Slowly but surely the insurance companies and some of the major health organizations are finally coming around to learning this whole concept that if you prevent things like heart disease, diabetes, metabolic syndrome, and even other things that we at HDL don't necessarily address, it actually is less expensive to the overall healthcare system.
I'll bet the pharmaceutical companies don't like that at all.
Well, they may not, but it may be something they have to become accustomed to. I've used the example several times of my own father a couple of years ago who had his first coronary event, and I was given numbers about what it costs and everything, but until I actually saw what his insurance company went through and what the hospital went through, his insurance company paid well over $300,000 for that one event. And he was only in the hospital a couple of days. Imagine what could have been prevented. Obviously, his health. I mean, who wants to have a heart attack? Mm-hmm. But not only that, okay, but to his insurance company and to the things that we pay for whenever we all have to chip in.
It's a trickle-down effect because he has that happen to him, and then everyone else who's covered by the same insurance company, their rates go up.
Sure.
And so it's a kind of this horrible cycle. So getting advanced blood testing is something that you can do, an important step in prevention.
And advanced blood testing is a fraction of the cost. I mean, the lab tests make up less than, it's between 1 and 5% of total healthcare costs. I mean, it's very low, closer to 1%. Yeah. But yet, the decision making that doctors use, 70 to 80% of our decision making is based on lab testing. So if you think about it, the labs are so inexpensive, it drives so much of our medical decision making. An insurance company is happy to pay for a catheterization, $18,000, $20,000, whatever it is, but yet, a few extra dollars for a lab test, I mean, just peanuts when you think about it. I mean, everybody should be getting this kind of testing, and then we understand what our risk is, we can do something about it when it's early enough in the game that we can prevent the disease.
Is it maybe because the idea of advanced testing is new to a lot of physicians? They're used to doing their same old blood tests to look for their same old markers for diabetes, for heart disease. And what we're learning is you can look healthy. We had your one patient, Chris, in, who he looked healthy on his test that the doctors did. But then when he got the advanced testing, he found out he's got a whole bunch of things going on under the surface, right?
I think a lot of it comes back to the education piece, okay? And I've had several doctors tell me, and I understand this, that the worst predicament they could be in is to have a result of something that they tested, and that A, they don't know how to interpret it, or B, the patient will ask them a question and they don't know how to answer it. So they need to be educated on this. But what so many of them find is when they dive deep into this information, they really kind of already know it. They just didn't know that they knew it. They kind of get in there and they go, oh yeah, I remember this. This makes sense. Sure, okay, yeah, this is easy. But it's just taking that first step and learning that information. Coincidentally, too, this is where healthcare is going to go. Doctors are going to begin, if not already, to be graded on this information. In fact, this will determine in the upcoming years, 2 to 5 years out, this will determine how they get paid. They will need to identify a patient's disease state. What am I doing about this disease state? Is the patient compliant? If not, why not? And then that will determine a pay scale for them. So they may have to get on board with this whether they want to or not.
Right, and this is something we should remind people, this is something that your doctor needs to order for you, which is why you work so closely with physicians.
Correct.
Absolutely.
Yeah, and I think that's such a good idea, too, to do it that way, because I feel like with the lines of communication open between my doctor and you, I feel better about that.
Right. And to piggyback on that a little bit, we find, unfortunately, there's a large percentage of the population that don't have a primary care physician. So we are developing a little bit of a program that we'll talk about at a later date, where we can actually get to the patient, okay, have them come in, go through some of this testing on a little bit watered down scale, but then get them to a primary care physician to be managed whenever we find those abnormalities.
That you'll be partnering with or something like that.
Yeah.
Fantastic. Well, thanks, you guys. Prevention is key. We always say that, and if it's one message that we can get across to everyone, and I know you've had some really good results too with the testing and more doctors ordering the tests and people finding out about it. So you can talk to your doctor if you're interested in getting any of the HDL tests. We will have Dr. Dahl and her colleagues back with us each Tuesday to learn more about their testing and how it can help you and your family. You can get more information about the Health Diagnostic Laboratory by going to their website, hdlabinc.com. You can also give them a call there at the numbers on your screen. And we're back with more broadcast right after this.